when our backs are up against the wall and we have nowhere else to turn. That's where it is what it is. Could we punch a hole through that wall and go in through a
Mm.
different way, still being compliant, safe, and ensuring that our patient is still getting the access that we need? Is the system designed to serve the patient? Who is that system serving? And can we revise the process to do that?
Hello, and welcome to Let Care Speak. I'm your host, Danyata, and today we're talking with Kelly Lorah. She's the principal of Laura Healthcare Alliance. And Kelly is also a healthcare executive with over 25 years of leadership experience across for profit and nonprofit health systems. She served as CEO, consultant, and strategic leader in some of the most complex healthcare environments in America. But what I love most about Kelly's work is that she's just not focused on operational efficiency. She's focused on how technology and human expertise can work together to reduce the burden on healthcare teams and improve patient experience. She's also an AI strategist helping healthcare companies navigate transformation and an advisor to early stage healthcare innovators. Kelly, welcome to Let Care Speak.
Dunyata, thank you so much. It's a pleasure to be with you today. I can't wait to spend this time with you. I'm looking forward to it.
Oh, well, thank you so much again. I appreciate you. And so, before we dive into your work, I'm curious about what drew you into healthcare leadership in the first place. What was that moment or experience that made you say, this is what I want to dedicate my career to?
So I was so fortunate to have a clear vision early in my life. As I entered my undergraduate degree at the George Washington University in Washington, D.C., I met with a guidance counselor that I was speaking with about some different school options as I was looking at the business school. And I said, but I really love healthcare. I'd love to stay involved in healthcare. And the guidance counselor said, have you considered healthcare administration? And I said, what is that? Through that conversation, we learned about a master's program at the George Washington University, where I then, as an undergrad, sophomore year, spoke with one of the professors in that program. I was inspired by the opportunity and took advantage of creating a curriculum of my own for healthcare leadership in the undergraduate business school at GW. I petitioned to the dean, I designed a curriculum, and it was approved so that I was able to both take business school courses as an undergrad in the business school at GW, but then also take undergraduate courses at the master's level through the master's in health administration program. I was so thankful to that guidance counselor for opening my eyes and to this world. And as soon as I started in those courses, I said, this is what I'd like to do.
Oh, wow. Kudos to that guidance counselor, and kudos to you for being proactive and advocating for what you want. That's beautiful. Very beautiful.
It was a lot of fun. It was a little daunting, but I think when I was young, I did not know how daunting it was. Looking back, I am surprised that I did that. But when you are young and ambitious, you tend to think you can make anything happen. And I still remember being in the basement of our library, pulling out courses from the master's program, demonstrating how it would apply to an undergraduate curriculum, and finalizing that petition and just throwing it out there to see if it sticks. If you don't ask, you may not get. So I always encourage others to put out your ideas and be innovative, and you might have something wonderful come out the other side.
Kelly, you've worn several hats through your journey in healthcare leadership on both nonprofit and the for-profit side. And so, what would you say throughout those years has changed for you just professionally over your 25-year career? And what have you learned?
I began my career at an internship that I started the same time that I was pursuing this degree and petitioning to be able to create an entire major around health administration as an undergrad, which they did not have. And I was part of the office of a CEO at a medical practice, 400 plus physicians affiliated with the George Washington University Hospital. I was hired to file and stamp parking passes and answer the phones and very small projects, and was always asking, what else can I do? What else can I do? And one of the pieces that a leader there told me was, if you keep asking for more, we will give you more and we'll see what you can do. I ended up staying in that role for 4 years. And by that time I had finished, I had built departments, I had led service line expansions, I had led a team that was overseeing all of the appointments at that organization, all at a very young age, because I was not only someone who was asking for what else can I do, but also I was given the space by great leaders to say, sure, I'll come up with a new project for you. And I was coached along those projects. I was also coached to ask for feedback. So I've taken those two elements and really applied that all throughout my career. How else can I help? How else can I be of value? And what do you think of what I've done? Do you have any feedback? So this could be better for both our physicians, for our team, for the patients, most importantly. So I think using that as a foundation has helped me when I would take on broader roles and broader responsibilities. And what changed from that small 2 or 3 questions that I would ask, and then evolving that as you're leading large multidisciplinary teams, is the importance of listening to that feedback, taking that feedback and applying it as you go forward. When I'm working either within a health system as a leader or I am outside as a consultant, your biggest opportunity to create a great relationship, to nurture that relationship, and to ultimately ensure that that project, that outcome, that goal has always woven in an inclusive style of listening, receiving feedback, and making sure that that feedback that was applied then to go forward into your work.
Oh wow, that is incredible. And I just want to commend you for adopting that philosophy too. And so you briefly mentioned patience, and I would just like to talk about that for a moment because you talk about reducing administrative burden to improve patient experiences. And just from what I've gathered with my experience with healthcare leaderships or just talking to those professionals, that's really not always the focus. And so why for you is the patient experience at the center of your operational thinking?
So I think every single individual and members in my organization and other fellows in the American College of Healthcare Executive, where we've all become board certified, our entire goal is to ensure that our patients remain at the center of all that we do. We ensure that as we are serving our patients and creating the best experience, the best environment, the best access, the best population health strategies, it's so consistent throughout all of our messaging in our education that we receive, that we are zeroed in on ensuring that that patient feels a comprehensive strategy for them that's tailored to them. Where there are challenges, where it may allude to some of the experiences that you might have had and many others, is the burdensome system. So we always say it's not the people, it's the process. And where the flaws happen in the process, whether it's by design, by funding, by um, lack of efficiency, or with challenges within technology and what we're able to use and document and be able to create a good experience for patients. That's where our barriers happen. And healthcare leaders are designed to, are wired to identify those barriers and find ways to break them down. We all have to work within the one of the most highly regulated industries, which is healthcare, and ensuring that we are creating accountable structures for that highly regulated environment while also balancing team members, our physicians, our providers, our other clinicians, physician assistants, nurse practitioners, CNRAs, all of those individuals and those humans that need to touch the process and make it better for the patient. So when a healthcare leader is approaching a challenge or a problem or an organization's mission and strategy, we keep it at the center, but we also are in many ways working through a lot of barriers. So examples could be documentation that's required for a prior authorization for a procedure that your physician, Danyata, has identified that you need. Yet there are specific, detailed requirements that need to be documented and submitted to a health insurance, commercial health insurance, for approval of that procedure. The steps in which those systems and tracking of that detail, those systems may not speak to each other. They may not be able to receive the information directly. And it creates a burden documentation. It creates a time burden for the team member that's trying to move that patient through that process. And then it creates ultimately, unfortunately, a delay for that patient. And then the provider is also the one that needs to go and continue to advocate for their patient and their needs. So, because of so many different systems, and that's just one example, there's a lot of focus as healthcare and leaders in where we have those opportunities to advance. And that's where we are seeing great technology tools that are looking to use AI, an intelligent assessment of what is needed in order to shorten those timelines and get patients the care that they need, increase access, and do it at the right place of care.
Oh, wow, Kelly, thank you so much for painting that picture because it explains some of the challenges that me as a patient wouldn't even be aware of. And here I am thinking, I'm just being neglected and overlooked because they don't care about me. But really, it could just be the processes on the back end, like you're saying, that aren't communicating, and that's creating extra work and extra burdens. So, this is where you come in. And so, thank you for doing what you're doing.
There are healthcare leaders all around this country and this world that have the patient's best interest at heart. And that is what makes us get up every morning in the field of healthcare and go to work and continue to advocate for our patients and advocate for our teams. And it can be tiresome and it can feel that you need to take those barriers and keep trying to solve the same problem in different ways. One of the things I always think about is when our backs are up against the wall and we have nowhere else to turn, that's where that's it is what it is. Could we punch a hole through that wall and go in through a
Mm.
different way, still being compliant, safe, and ensuring that our patient is still getting the access that we need? But is the system designed to serve the patient? Who is that system serving? And can we revise the process to do that? I always think that the team members, the physicians, those that are actually doing the work of direct patient care, they have the best ideas to improve the system. So healthcare leaders, it's our job to listen.
Mm. I just want to touch on AI very quickly because you talk about AI as a tool that works alongside the human expertise and not replacing it. And so, how do you think about the relationship between AI and healthcare professionals, and what does that partnership look like?
AI is a tool. It is not a replacement. it can be seen as augmented intelligence for us working through systems that we may have in the past had to manually pull together data sources to paint the picture and the story of where we're going, what we're trying to do, how we're going to execute, and then the actual execution of said outcome or goal. And the importance of AI within healthcare leadership is for healthcare leaders today, and this is where a lot of my work comes in, is to identify what are going to be the best tools to integrate into our system to solve the problems that are most important to us with performance outcomes that will be sustainable. Many healthcare systems work with multiple pilots, and sometimes we see those pilots may have been marginally successful, but we weren't able to create space or the time or the focus for that marginal success to be able to build and grow by giving great feedback on how to improve these tools. So I think ultimately AI should be viewed as a tool. It is there for us to upskill our existing teams. There are roles that will, especially in healthcare, never go away. There is nothing that can replace, at least now, a physician, a surgeon, someone who is actively along the bedside with a patient, making sure that they're getting the care that they're needed, triaged, assessed, and accurately directed to the right place of care at the right time with the right provider. Tools are there to help those individuals do that work faster, more effectively, with better access, with better outcomes, and ensuring that the patient feels the process is smoothing as opposed to the fragmented experience that many, sounds like you as well, have already been experiencing for decades.
Mhm. Yeah, yeah. And I'm looking forward to these AI tools working alongside these healthcare professionals just to improve the overall patient experience. So keep doing what you're doing.
It's the leaders that are out there in the health systems today that are truly assessing now and leading teams in adoption, healthy use, and ensuring that patients feel that they are a part of the process as we go forward. And so I know there are so many healthcare leaders out there that are uh, working through this in an intentional, focused way because we recognize the importance in our industry of ensuring that we are naturally risk averse, which makes sense. We need to always keep in mind our patient safety first and foremost, privacy, confidentiality, and then ultimately ensuring that our teams continue to feel engaged and motivated by the work that they do every day. And while the work may look a little different because we have these new tools, how can we see those tools as augmenting our work for a better team member experience, a better physician experience, a better clinician, better nursing experience, so their days go smoother as well?
And so back to the patients, because for the healthcare professionals, that absolutely makes sense. But from a patient perspective, I would say that oftentimes they may get overwhelmed with the medical jargon and the instructions and just all this wealth of information. And so how do you think about simplifying the healthcare communication when it comes to the patients? And what would that patient-centered communication look like?
So, patient centered care has been a focus in healthcare leadership for the better part of my career over 25 years, focusing on how we can make sure that it's not just patient centered care, but it's patient centered communication. And so you'll see things that have been occurring and really brought into a very consistent pattern in inpatient care, such as patient rounding, ensuring that when our team members are entering an inpatient room, they are speaking directly with the patient and the family at the same time. They are giving space to be asked questions and answer those questions. we want to make sure that our patients, through our patient engagement scores, feel that they were listened to and we were hearing their concerns. So we're not missing things that they're sharing with us that might be flags for other underlying issues, comorbidity, and other challenges that the patient may be facing, including social determinants of health. So it is so important that we keep our communication structured in a way that we hand off patients in a structured handoff. And there are processes that we use in health systems for that, so that a patient's needs and concerns don't fall through the cracks when we're handing off from one team member to another. And the other very important piece around patient centered care is that we're creating, through technology, many different tools that are taking the medical diagnosis, the plan of care, the after discharge instructions, your after visit instructions, your long term care goals. Take those documents and it presents it back to the patient in plain language. Well, also, there are different systems that also give the opportunity for both a plain language and then a medical expert version. And so you can look at those two side by side, and the patient can see, when my physician said this is what that means for me on my day to day when I get home from the hospital. And these are the care instructions I can follow in plain language. Patients are stressed and scared when they're in even an exam room in an outpatient environment, an urgent care, emergency department, medical surgical units in a health system, intensive care, and all beyond. So because of that stress, our bodies, our brains do not process information at our normal state and or as well as our normal state. And so it's so important for us in healthcare to make sure that we have the patient re-articulate what we said so that we can validate there's understanding. It takes time and it needs to be an intentional conversation. And many health systems, many healthcare leaders, clinical leaders, administrative leaders are creating spaces for their teams to be that coach and individual in the room with the patient to give them the opportunity in the space to ask questions. We expect that, and we want patients to advocate them for themselves.
Thank you so much. Because speaking from personal experience, especially when it comes to being discharged, it always feels as if I'm being rushed. And for you all to come in and to encourage patient advocacy, asking questions, and just holding space for us, it helps so much when it comes to what to do at home and just following up with that plan of care. So once again, I just thank you so much for doing what you're doing, Kelly. You don't even understand.
It's the
Okay.
work of the teams out there today, every day, right now, that are at bedside rounds. They're doing every hour, they're rounding on their patients, checking in on their patients, or they're sitting in an exam room and they might have other patients waiting. But in that
Mm,
moment, the patient needs to feel like they are the most important person.
facts. And so, Kelly, I've mentioned this before, but you've worn a lot of hats. And like one of those hats is that you also work as a fractional leader for early stage healthcare companies. And so, from your experience of working with them and so forth, what do you say that founders get wrong about healthcare adoption? And what do these founders need to understand?
I mentioned it earlier, but health systems are intentionally slow in their assessment and adoption of new services, technology, solutions because of the potential risks that are abound in this highly regulated environment. So much of the time that I spend translating health system needs with my fractional roles and with founders of amazing solutions that have the power to transform, because those are the only ones I talk to. Those solutions that I do believe have the power to make patient access, patient experience, and patient safety at the forefront is, as I'm translating that timeline on their go-to-market strategy, is ensuring that there's continuous coaching on the timeline that it takes to just move through a health system's process for assessment, their rubric, their decision making matrix, their legal team, their operational team, and recognizing that adoption is slow. Some health systems, while they have innovation arms, it's still important for them to be slow and methodical about their assessments. And that is something that I find is a little different than other industries, because at the end of our conversations, at the end of our process, at the end of our solution, our technology is you, Danyata, is me, is our family members as that patient on the receiving end, maybe very indirectly, but because we're patient centered organizations, we need to make sure that that right solution makes sense across the full multidisciplinary view, and ensuring, especially in health systems, that there's awareness for founders that there is rarely one decision maker. There is an expectation for an inclusive, multidisciplinary assessment of solutions, as opposed to just one individual who's saying yes or no.
Wow, I think that you answered this question already, but I'm going to pose the question anyways because this actually leads into it. And so, if you could give healthcare leaders one piece of advice right now, either regarding AI, operations, or patient care, or even just leadership in general, what would that be?
I believe very strongly in failing forward. And when we can adopt in a compliant, safe way something new, when we track it, we measure it, and then we validate that it did or did not work, even if it didn't work or it only fixed a portion of your problem, and that might seem like a complete failure, did you fail forward? And could you have given some of that feedback to a founder or a developer and another innovator, that one piece of advice that could then build something completely new and different and exactly what a patient or a facility may need? So I think failing forward, being open to that, creating space for alignment with founders to fail forward together on this quest for a better healthcare industry.
Beautiful. I love that so much. And so, Kelly, for our audience, whether they're healthcare leaders, patients, or people just interested in healthcare transformation and healthcare administration, how can they connect with you?
I have a very, very accessible calendar because I intentionally want to continue to expand my world and my network through amazing conversations. And that's how I met you, Danyata, was being open and being accessible to have lots of different conversations. That's how I've been able to create new value for health systems, create value for startups, create value as I look and explore with developers new innovative ways that we all can partner and create new solutions in the healthcare space. So I have a website that I know we might be able to share at the end of this, and I'd love to talk to anyone about their healthcare leadership career, their ideas for innovation in the healthcare space, and how we can build something incredible together.
Um, Kelly, thank you so much for this conversation. And what stands out is your belief that healthcare can be better at not just more efficient, but more human ways. And after 25 years inside healthcare systems, you've stayed committed to solving the problems you've seen using operational intelligence and AI to support teams to support patient care. And through Laura Healthcare Alliance, you're helping organizations rethink how they operate while keeping patients at the center. And again, thank you so much for your leadership, your vision, and your commitment to making healthcare better. And this is Let Care Speak, because when we speak about care, we're speaking about the most human thing there is, our commitment to each other's well being. And remember, better clarity leads to better understanding. Thank you so much for listening.
Thank you,
All
Diana.
right.